So, first of all, I think it might be a little bit helpful to know something about Liezl. So, Liezl, I wonder if you could tell us a little bit more about yourself and
Mhm.
what has generated your interest in ADHD and mindfulness.
Sure. Um, it's actually sort of back to front. My interest was in mindfulness before I trained as a therapist, and I trained as a therapist before I was aware I was an ADHD-er.
Right.
So that's the process of it. So mindfulness got me really interested in how human brains work, and I don't mean the mechanics of it, like the thinking patterns and the feeling patterns and how that affects behavior. And if that doesn't sound like action, behavior, and feeling, I don't know. I mean, sorry, action, thought, and feeling. I don't know. So there's that triangle that you get in CBT, right?
Right.
Which is my modality.
Yeah.
Okay, so first mindfulness, then I got interested in becoming a therapist, trained as a therapist, and as one of your courses, the Finding Your Niche
Mhm.
course, got me thinking about that I needed to have something that meant something to me that I was going to be able to help clients with directly. And it's through that, as well as having a child diagnosed with a neurodivergence, that I started learning about neurodivergence. Now,
Mhm.
said child has a different flavor of neurodivergence from my own, but it was through sitting through lots of talks and learning about that made me go, when they say you were never broken, I feel a thing. Um,
Oh,
I feel a
really?
thing that's really quite sad. And it feels really close to me. This can't be about my child. And it was about me. I
Interesting.
found out eventually that I am an ADHD-er.
Mhm.
And it made me go, oh, do you know what? All those times I sat through therapy with people who really didn't get what was going on for me and absolutely misunderstood me, no matter how much I tried to explain myself. I want to be that person for someone else who's in therapy and maybe doesn't know they're an ADHD-er,
Mhm.
or maybe clearly knows they're an ADHD-er and keeps finding that actually people don't get what's going on for them. People seem to think that they need to be fixed, or they seem to think themselves that they need to be fixed, and actually it's an understanding of yourself that's much more useful.
Yeah. Yeah. I mean, in a sense, that's almost what fixes you, though, isn't it? It's
Yeah,
almost sort of like you don't need to be fixed, but
no,
by understanding that this is who you are
yeah,
is what brings the healing, isn't it? Because,
exactly.
yeah, although this, I mean, that's cutting a long story short, isn't it? Knowing.
Very.
So, listening to people who are neurodivergent, there's an awful lot to process, isn't there, about
Mhm,
the way you've been treated through life, how life
mhm,
perhaps could have been different,
mhm,
all these sorts of things that are actually quite painful for you. I think it's interesting that you said you
yeah.
felt that sadness yourself. Yeah.
Oh, it hurt. It was like a stab. And the interesting thing was my first niche that I thought of was grief, because that's
Yeah.
one of the bits of placement I had.
Mm.
And that sense of grieving when you recognize that you didn't have the childhood you could have had.
Mm.
Um, you didn't have the childhood that you maybe should have had, right?
Mm.
That other people had.
Mm.
That if everybody knew, they would have given you. Um,
Mm.
and that's a lot, if you recognize as late as I did, not telling you what decade, but um, then there's a lot of decades worth of work to do to go back, and that thing could have been different, and that thing could have been different.
Yeah.
But you kind of get that understanding that, you know what, if that thing had been different, you wouldn't have had the experiences that you had, and actually you wouldn't have learned the things that you had, and you wouldn't have been the rounded person that you are.
Yeah. Yeah.
So you have to work through all of that to get to the understanding that, you know what, that suffering was suffering for sure. Um, but I'm in a different place now, and I'm able to process that differently because I understand now none of it's my fault.
Yeah. Yeah. It's sort of like coming to terms with it and then having processed it, sort of realizing that you are the person that you are,
Yeah.
or not necessarily in spite of it, but because of it. And that,
Yeah.
actually, in a funny sort of way, I think you sort of get to that point where you think, well, actually, if I hadn't been through all of that,
Hmm.
I wouldn't be me.
Yes. Yeah.
And I think you can actually perhaps come to that point where you think, actually, I quite like me.
Absolutely. It's that empathy with yourself and compassion for yourself that actually builds this sense of like a more solid self,
Yeah.
something you can rely on,
Hmm.
so that it doesn't, especially if you're looking at insecure attachment styles, you no longer feel that you need that from everybody else. You can give it to yourself.
That's really
It's
interesting.
a much healthier way to be than needing it from everybody else. What you get from other people is a bonus. What you give
Yeah.
yourself is the bit you can rely on.
Yeah. I'm just going to literally pop up how you can get in touch with Liezl if you are an ADHD yourself or you work with ADHD-ers. I'm just going to leave that up for a while because I know that Liezl's be really happy to make contact with other therapists who are working in this area. Now, I need to actually admit that Liezl wrote to me after I'd done some of the advertising and said, there is this slight problem with what you've said. And the thing is one of the things that Liezl's done is she's actually applied for access to work, which is part of the reason why Liezl and I were able to work together, because she used some of her access to work funding for some coaching. And I just made this massive assumption that in order to get the access to work funding, you need to have diagnosis for ADHD. So I said, Liezl's diagnosed with ADHD, but you corrected me, Liezl, didn't you? And actually, you haven't got an official diagnosis.
No, I don't. And I don't, for me, because I'm not interested in going on medication, I've lived, okay, I'm going to say it now, I've lived 50 years without knowing, right? I'm not interested in going on medication. Getting a diagnosis is, yeah, all right, so it's going to be a bit of paper from someone who's done some education, and it is a useful thing for many people, but for me, it's not going to change much.
Mm-hmm.
For me, I have a clear understanding of what it is to be an ADHD-er. You know, I've done all the questionnaires. I've done a load of the things that you would do in an assessment for myself and checked it with other people for validity. But I haven't got a bit of paper that I've paid for or that the NHS has handed me. So, yeah, to your point, the access to work thing, I don't have a diagnosis, but I do have access to work funding. So if you're a therapist and you have something that makes it hard for you to do your job, it doesn't have to be mental health. It could be a physical health thing. It doesn't have to be neurodivergence. It can be a variety of different things. Then access to work has got thousands of pounds sitting available to support you with that. Things have changed a little bit since I got mine. They've got a lot stricter on what's allowed. And it's important to get some support on when you're doing that. And I can, if you're networking with me, I can definitely point you in the direction of a few people who are very interested in supporting you in that way. Even for free conversations, just to talk you through the process and give you some guidance before you put pen to paper, or to help you with that accountability piece that says, I have to fill in a form and I'm an ADHD-er.
I know. I read this beautiful little bit on Instagram from Wendy, my photographer, who did my photography recently, and she is so ADHD. It's just so obvious. But of course, she said, it wasn't obvious to her. And then, she got this letter back, and it said, "Oh, at the moment we don't have enough information for your diagnosis." She said, "Cue hysterical meltdown and a 3-hour nap."
Oh yeah.
She said, then I woke up and I read the rest of the sentence, which said, "So we'd like a little bit more of information from you." I just thought that was so well put about what it feels like. And then she said, another hysterical meltdown because I had to fill a form in. And, she got someone to help. But this is often sort of like, there's so much gatekeeping around it, and it makes it even more difficult for people who've got ADHD to be able to get the help that they need.
Yeah.
But anyway,
that's why I'm really glad you don't need to have a diagnosis to get it, right? Because that would just be one more obstacle that so many people wouldn't be able to get over.
Yeah. We're just getting a couple of comments in here, which I think might be sort of interesting to look at. So
you're the only one. Oh, you can see them. I can see them as well now.
Yeah, you can see them as well now. So Anne says, I work more and more with undiagnosed, but a colleague tells me it may be people have had trauma, so they only present with traits of ADHD. So I think that's a sort of question, because there's this big debate, isn't there? And I think, who is it? The doctor guy who does all the stuff about compassion. Name escapes me. Do you know who I mean? I keep dropping hints.
I think it's Gabor Mate.
Yeah, that's right.
Yeah. Him of Scattered Minds fame.
Yeah, because he sort of says that he thinks a lot of it is to do with trauma, isn't it? But I think that's quite a controversial. Yeah, you see. Sorry, I'm just going to.
Is it blowing up?
Wendy said.
Are people saying lots of things?
Wendy got there before me. Gabor Mate.
There you go.
Yeah. So, I mean, he sort of talks about ADHD being like trauma, isn't it? And So Wendy said this, very controversial.
Yeah, exactly. You'll be sitting, there'll be people feeling real discomfort right now.
Yeah.
So what he says about ADHD is that it's, it sounds like it might be kind of, trauma might be kind of causal to ADHD,
Mm-hmm.
which indicates if you can help people to work through trauma, then that, leads to the belief that maybe you can work through ADHD.
Mm-hmm.
And actually it's different because ADHD is a phenotype, is a type of brain,
Yeah.
whereas trauma is something that people can process.
Mm-hmm.
Oh, there we go. What's
Yeah.
Adino saying?
Russell Barkley, American professional, says you're born with it, inherited from parents.
Yeah.
Yeah.
And that view is big in ADHD circles. A lot of people believe that that's the right way. Now, look, there's going to be lots of different points of view to this, and there'll be studies in both directions. And to be fair, it doesn't really matter, because right now I'm an ADHD-er. And what I wanted to say about trauma and ADHD is that people will present and with something that looks like either ADHD or trauma, and actually they overlap a heck of a lot in the way that they present. So you're fair to say, ooh, what if it's trauma? Well, then find out, is it trauma? Because if it's trauma, there's something you can do to help.
Mm-hmm.
If it is trauma and people have already processed that, a lot of the times my clients come to me after they've worked through their trauma. And go, okay, so I've dealt with that now. I recognize that was then and this is now. And then we go, okay, so what's kicking your bum now? And then we try and work out which of these things is to do with ADHD and what strategies can we put in place. A little bit more coachy than therapy at that stage.
Mm-hmm.
But if they come with, the work before the recognition of ADHD, then we work through the traumatic stuff first. But either way, accepting how it is the beginning of feeling better.
Yeah. And I think it's very interesting what you said at the start about how you'd had therapy, but actually the therapy hadn't really touched on that sense of feeling different.
Yeah.
It hadn't really answered
Yeah.
that sense that you had and the feelings that you had, that sadness that you expressed when your daughter was diagnosed, that, it presumably, you talked about all those things in the past and all the rest of it that had gone wrong, but it's sort of like in a way this gave you like the last piece of the jigsaw, maybe, that when you did that, it suddenly it made a picture.
Made sense, absolutely. Yeah, some of the therapy I had done was trauma related. And at that point, I had no idea about the ADHD. And so I'm really delighted that those things were nicely separated for me. So I didn't have this confusion, is it this or is it that? Because I had already processed that. But certainly with some therapists, and particularly less experienced ones, there was a sense of, I can't really tell them that what they're trying to do right now is not touching the sides. What they're doing right now invalidates my experience, and I don't have a language to tell them. And I certainly don't have the authority to say, well, you therapist authority figure, I think you've got it wrong. Because maybe I'm just different from everyone else. And that sense of shame about being different from everyone else wouldn't let me talk about it.
That's it, isn't it? And it's so difficult, because I think it's difficult for us as therapists sometimes to maybe pick up on that. We might know there's something that we're not hearing, but we don't know what it is. Yeah. And I think understanding neurodivergence can really help the framing of what the problems might be as well. It's almost like it's another avenue to help us understand our clients.
Absolutely. We're not there to lead the conversation in any way, but if we've got the understanding of it and a framework of what fits with what, then it's easier to connect the dots when your client brings you what's difficult, right? So I would definitely recommend learning more about ADHD and how to spot the signs, especially if you're neurotypical yourself, because you're going to be much more able to give your client what they need. You're going to be able to be more understanding of what's going on for them.
Yeah, thank you. So let's move on to talk about ADHD clients and mindfulness.
Yeah.
So can we define mindfulness?
Okay. So there's a load of different definitions, but they boil down to the same thing. It's being able to be present in the moment with your experience. So noticing what's going on in the moment without judging it.
That's that that little bit at the end, that can be really difficult, can't it? Without
That's where
judging
the
it.
work is.
Yeah, yeah. That's
That's where
really
the work is.
interesting. Yeah, yeah. So I just wondered, what encouraged you to get into mindfulness then?
Okay, so there were some signs that I was an ADHD-er, right? And I didn't know. My brain was super busy. I couldn't get peace. And the only time I ever felt as though things were settling down for me was that last bit of yoga when you're lying down and trying
Oh
not to
yeah.
fall asleep or make unacceptable noises. Um, I know we're
Mm.
live here. And I only felt peace then. So,
Mm.
you know, I'd done all my movements and done the stretching and whatnot, and then lay myself down on the yoga mat and I had peace.
Mm.
And I was like, I want more of that. I really need more of that. Honestly, the
Yeah.
rest of my life is far too busy in my head and I cannot get peace. I can't rest. I was having difficulty sleeping. So even when there was time for me to settle, even if I actually made time to settle down, couldn't do it. There was this kind of fizzy thing going on. And I asked my yoga teacher if they knew of anyone who would be able to teach me any mindfulness. And as it happens, a new mindfulness tutor had just set up a group in Kelso and was doing it. And this was the miracle of all things, was doing face-to-face sessions for free.
Mm-hmm.
And I was able to attend because of that.
Mm-hmm.
So I attended that course. And this is a thing, it took me, I wasn't quite getting it on the first go. I
Mm-hmm.
went to the 8 sessions and I said, okay, I'll come back next time you run it and I'll put out the chairs and I'll make the coffees and the teas and I'll get people to sign in because I need more of this. And I don't quite get it yet. So I had an obstacle in my way. And thankfully, because these courses were getting done for free, I was able to go back and do it again and again. Had that first course been set up for ADHD-ers, I think there's a high chance I would have got it more
Yeah,
in the
that's
first go.
interesting. Yeah, yeah.
But thankfully, you know, ADHD also gives you a tenacity.
It's a special interest, yeah.
Yes, that's what we're calling call out. The rabbit hole that lasted a long time.
Yeah. I was going to say, because you've actually got a guide, haven't you?
Yeah.
Which I'm just putting up here. If you go there, you'll see that there's a free mindfulness in daily life guide, and you can sign up for that and download it. And it might be useful for clients as well. That might possibly be something that people might like to share with their clients.
Yeah, feel free to use it.
Yeah. So, how do you think mindfulness can help ADHD clients?
If you look at the ways that ADHD presents, emotional dysregulation, difficulties remembering things, difficulties focusing on things, sometimes sleep, unable to just do one thing at a time.
Mm-hmm.
See where the links are?
Yeah.
Because if you're able to find ways to regulate your emotions, you're much more able to pick one thought out of the thousands that are going around in your head.
Yeah.
And mindfulness really, really helps with emotional regulation because it allows you to see it in a sort of observer view rather
Mm-hmm.
than being right in the middle of it. So emotional regulation, all the words are there. They were stuck behind my teeth for a second.
Yeah.
Executive function, that this goes after this goes after this kind of situation that comes from
Yeah.
the prefrontal cortex is
Yeah.
something we can't do, right? But there are studies that prove that people who meditate, which is the formal part of mindfulness, grow connections in their brains. So they're actually making new neural pathways in their brains. And that helps with executive function.
Yeah.
So you're growing new bits that are just a little bit puny at the moment, right? And you can make a difference by what you do to your own physiology.
Yes. Yeah.
To me, that sounded like complete nonsense when I heard it the first time. But actually, there's loads of studies that prove it.
Yeah. I was going to say that it's one of the things that I find mindfulness has really helped me with. Like you say, it gives you that emotional regulation so that you sort of notice if you're getting reactive to things.
Yeah.
And then because, like you say, your brain is sort of like developed a little bit.
Yeah.
It gives you more time before you react, doesn't it? This is where
It's
I found it.
practicing the pause.
Yeah.
You know that Viktor Frankl quote, what was it? The gap between impulse and action
Yeah.
is where your power lies. It's something
Yeah.
like that. I'm not doing it exact
Yeah.
justice here. But finding that pause is what mindfulness is all about. Because
Mhm.
your impulse comes in, you have a moment to look at it, not do anything,
Yeah.
recognize what's going on in that moment, sit with it for a bit, and then choose to do it. The number of clients I've seen who've come back and said, oh, I've been practicing the pause and here are my results. And they're like, I used to really fly off the handle about XYZ. And actually, I realized when I stopped, it wasn't about this moment at all. It was about all that baggage I've been carrying around with me. And they don't even have to be neurodivergent for this to be useful, but obviously neurodivergent people, and particularly ADHD-ers, have more of this. And so, dealing with it in that way gives us tools that means that our actions are not going to make our life harder.
Yeah. Because it sort of enables you almost to notice what's going on more, doesn't it? So, I mean, I've got quite sort of scatterbrainy sort of brain, and I'll notice that I'm doing things, so
Yeah.
usually it's something sort of like, well, I'll just quickly look that up on Facebook, and then 15 minutes later, I'm still on Facebook because I've got completely distracted by it. But it's about noticing that, isn't
Yeah.
it? And sometimes it's about, no, it's all right. I can feel this impulse to go and do something and I think, no, let's draw it back, do this thing that I was going to do, not allow that distraction to come in, because I've actually noticed the distraction is there. And I think that's sort of what you're talking about in a sense with the executive functioning, isn't it? That it helps you
Absolutely.
to notice.
Yeah, being able to put things out in order. And the thing that's just come up for me as you were mentioning that is, if you rely on remembering that you were going to do the thing that you set your intention to, it's hard because you're not going to remember things very well as an ADHDer.
Mm-hmm.
Whereas mindfulness draws our attention into our body. And you've always got your body with you.
Mm-hmm.
While we're in this life, if you believe in reincarnation, while we're in this life, this is the body you've got, right? And if there's a safe way for you to pay attention to that, your body will tell you what your emotional experience is like. Very often, if you're, go tell me, what does your body do when you're feeling stressed?
What, me?
Mm.
Yeah. I might feel it in my tummy. I might hunch my shoulders, usually, and I might sort of get a bit
like that.
Do you know what I mean?
Yes, I think I do. Okay, well, I'm guessing I think I do.
Yeah.
What mindfulness does is it makes us stop, right? If you're going
Yeah.
to be practicing formal mindfulness, what you're going to do is you're going to sit for a bit, not necessarily a long time. That's one of the things I've made sure in this course is that we're not sitting for that long.
Mhm.
You're just going to stop intentionally and kind of feel into your experience. So you're bringing your awareness out of the space that you're in, into your whole body, into your breathing,
Mhm.
into the seat, and then into the floor. And as you're doing that, you're paying attention to your body. And your body's going to then go, oh, you're paying attention. Let me just point out that you've been wearing your shoulders as earrings.
Yeah.
And actually, there's a really tight bit at the lower back because you've been sitting all day.
Yeah.
And maybe you've got a furrowed brow because you've been worried about something.
Mhm.
And we often don't know, especially as neurodivergent people, we often don't notice those things about our body because we skim straight over the top of it. A, because we maybe have a bit of a difficulty with interoception.
Yeah, I was going to say that. Yeah.
Or B, because actually we've been trained not to pay attention to how our body is feeling because our body feels things a whole lot more intensely than other people's do.
Well,
So
that's
you don't want to be
interesting, isn't it?
seeming like the sensitive one who's always moaning about their body. And we've got used to the idea of not paying attention. So our brain and our body have split. And our heart's somewhere in the middle, not attached to either.
Yeah, it's really interesting. I mean, I love the stuff about, that's just really made me think about how we've sort of separated ourselves out from our bodies because we've been too much almost. And that means that we try and damp down our knowledge of our bodies. So it's a really interesting thing to hear. But I'm just sort of thinking about your clients who come in. How do you help your clients in the sessions to
In
do this
therapy.
sort of stuff? Yeah.
Yeah. Okay. So my modality is cognitive behavioral therapy.
Yeah.
And so if you know about cognitive behavioral therapy, you know that it involves looking at how you're thinking about things, how you're feeling about things, and how you're behaving. And because it's such a structured way of therapy, a lot of ADHDers actually said on all the forums, CBT is rubbish for ADHD, right?
Yeah.
And I think to some extent, it depends on the experience they've had. They could be right. If they're not allowed to process this stuff at their own pace, if there isn't enough time to
Mm-hmm.
let an ADHDer tell you the story in the way that they can,
Yeah.
for example, the detail sometimes really matters to people with ADHD, right? And they need to give you the whole thing, especially when there's overlap with autism,
Yeah.
as there is for roughly 40 to 50%, I think. If you dampen down that necessity to tell you all the stuff, they forget what they were there for in the first place.
Mm-hmm.
And so especially if you're doing it on a service that has a limited number of sessions, then CBT can be tricky because you might not manage to fit in all the stuff that you wanted to do in that time, because people maybe need a bit more time to express themselves and
Yeah.
to feel comfortable and safe, because they've
Yeah.
been in many, many places where they've tried to make themselves understood, and
Yeah.
folks haven't, and just tried to squish them into the mold that they need to be in.
Yeah. Yeah. So that was sort of a bit
So
about what's difficult about
CBT,
maybe using CBT. I mean,
yeah.
when I was thinking about it, I thought I had someone who, I don't know if this is a CBT thing or not, but I can remember her giving me this sort of postcard, and we wrote down all these affirmations, and she said, right, go away and practice these affirmations. And I found the postcard in my handbag about 10 years later, never having
Yeah.
used it. Do you know what I mean?
Yeah. So when I do homework with my clients, for a start, we have this good conversation at the beginning about how they feel about homework, because guess what? There's going to be an awful lot of yuck attached to that about them being not good enough from
Yeah.
school days, perhaps, unless they were one of those overachieving style ADHDers, in which case nobody noticed they were an ADHDer because they were coping fine with attainment.
Yeah.
So when we set homework, I make it very clear from the very first session that homework isn't really homework. Homework is your specialist interest.
Mm-hmm.
Homework is you finding ways to bring yourself closer to the goal you've set with me at the beginning.
Mm-hmm.
And so at when we get to the bit in the agenda, when I say, what are you going to do for your homework this week? It's always about what feels achievable to them, what
Mm-hmm.
they would like to do, what's going to be relevant to what's going on in that week. It's not about this form that you need to go and fill in. Go and make sure you do that thought record. Never going to happen. Like you say, it's going to be in your handbag 10 years later. Whereas the homework that I set sometimes does involve that, but only if it has been useful in the session and the client was receptive to that specific intervention, like
Yeah.
a thought record.
Yeah.
Sometimes it's other things. Sometimes homework is self-care.
Yeah.
Sometimes homework is go and bring us back some evidence that you were good enough this week.
Yeah. So I'm just thinking about mindfulness, sort of making this connection with mindfulness and mindfulness training, because mindfulness training does take quite a lot of practice, doesn't it?
Yeah. Mindfulness training, most well accepted courses are at least 8 weeks long.
Mm-hmm.
Some of them have an introduction, then the 8 weeks, and then a session after. Oh, thank you. And so it does take a long time to learn mindfulness, but it's not a case of going to the course for the 8 weeks and then that's you done, you're as mindful as you can be. It's about setting up a practice for yourself. It's about finding a routine in which you stop yourself and check in with yourself, and allow yourself to be still, allow yourself to recognize what's going on in your body, what's going on in your emotions and in your mind. And this mindfulness course that I've set up specifically for ADHD-ers that I'm going to be running from the 19th of September is a way for ADHD-ers to do that in a way that suits them, because most mindfulness courses say you must practice first thing in the morning, and it's a really good idea if you maybe practice again before bed, and it has to be for this length of time. And if you're doing a course, well, this week we're doing that practice, do that one. Or alternate between this one and that one. It can feel very prescriptive, and I know anybody who's trained with me, anyone who's ever delivered a course to me, this is not how you said it. But this is how it can feel.
Well, it's also there's that demand avoidance as well, isn't there, that can come up for neurodivergent people. Yeah,
Absolutely. And I noticed in myself as time went on with my practice that all the courses say, oh, you've got permission to look after yourself and you're allowed to not do this practice or stop halfway through and change to this practice instead if that's going to work for you. I wasn't going to do that. I had been completely programmed to be a people pleaser. So even in my inner world, when I'm sitting still and no one knows what I'm thinking, I was people pleasing. I was going, no, I must sit with this, even if it's really blinking hard, even if it hurts like hell, I must sit with it. And it was an obstacle to me, instead of going, I'm allowed to give myself an out here. I'm allowed to go, do you know what? No, this one's hard. I'm going to take a break. I'll maybe come back to it. I'll maybe do something else. But I couldn't. And I think that was probably one of those obstacles I was facing in the first course I attended.
Yeah,
I couldn't give myself permission to make those changes. So now as the tutor, I'm giving people permission. I'm saying when you're going to be doing your practice at home in between sessions, they're coming for you, Josephine.
Oh, you can hear the
I can hear the siren
in the background. Yeah.
When we set the options for doing practice in between classes, it's a menu of things people can choose from, and I'll make the connection. This one is more for physical mindfulness. This one is more for compassion. This one's shorter, that one's longer. You can practice this one on the bus. This one really needs you to be on your own.
Yeah.
It's that kind of choice that people need. They need the autonomy. So if you've got a PDA profile, that's the way to go. Make your own choices because
Give
they're there.
people the choice. So do you find that works in actually sort of when you've got someone in front of you in therapy as well? If if you're talking about mindfulness with them, is that what you do? Would you talk about mindfulness and then?
I don't call it mindfulness initially.
Yeah.
Because a lot of people assume I'm going to make them sit there for half an hour, and honestly, that's not what I paid for. Is usually the thinking that's going on.
Yeah.
So what I'll talk about is the connection to their body in the first place, and how, and if they're particularly stressed, I'll bring mindfulness in as a way of helping with that. And so sometimes somebody will come in and they've been rushing because time waviness is what we're going to call this is for my clients, for ADHD-ers, can be a thing. So they may have had to rush there, or I may have had to send them a reminder and they're now 5 minutes late and up to 90, because that whole transference thing's going on and they're thinking I'm going to give them a hard time for being late. So when that happens, what I might do is I might say, okay, well, I can see you're really quite wound up by this. So I wonder how it might be if we just took a moment just to give you a break, because it sounds like you've been in the middle of a lot of things. And then I'll take them, if they agree, I'll take them into just a 5-minute breathing, there's a 3-stage breathing space. I might do that with them. It takes somewhere between 3 and 5 minutes, depending on what we're doing.
Yeah.
And what it does is it disconnects them from what's outside that door, and it disconnects them from what comes next, because they're having to listen to me guide them through it, and they're having to pay attention to their body and their breathing, and it brings them into the moment. And once they come out of that, I go, okay, so how are you feeling now? Tell me what happened during that process. And that gets people to check in. And then if they still don't make the connection, I'll say, how are you feeling before we started that? 5 minutes ago. And when people then go, do you know what? I'm actually really relaxed now. I'm actually feeling like I could have a nap. I go, okay, what else can you do in 5 minutes that helps you to feel that?
Yeah.
And a lot of the time people go, yeah, it was only 5 minutes.
Yeah.
And then that's an opportunity to go, do you know what? You can do this anywhere.
Yeah.
You don't have to you don't have to wear a special anything. You don't have to have a specific chair for it. And particularly people with mobility difficulties, you can do this in any position that's right for you. What matters is the intention to pay attention to what's going on right now, instead of letting your mind wander to the past or to the future.
Yeah. So it's sort of like what you're doing in the session is it's almost sort of like show, not tell, isn't it? You're actually getting them to experience it.
Yeah.
So
And that's what the course is like. It's
Yeah.
experiential. It's not
Right.
it's not an academic thing.
Yeah. I was going to say, do you do anything else with them during the therapy sessions, or would that be mainly how you use mindfulness in therapy?
No. There's another practice that I use a lot, called self-compassion break, which is belongs to Kristen Neff.
Yeah.
And it's a 3-stage thing that helps people to look at their suffering. And I've worked with people who you wouldn't expect to be in therapy in the first place, because that's not their bargain and they were never going to go there. But they found that in their life they're having difficulty and actually they don't have an answer for it. And they're now coming to therapy like, I don't want to be here, but I'm doing it because I have to.
Yeah.
And suggesting to someone like that they go and sit still for 3 minutes and give themselves some compassion, can feel like like they're really resistant to it.
Yeah.
So what I do, I'll start off with, this week, I wonder how it might be if you could come back and let me know all the little moments when you had a bit of difficulty, especially people who are very independent and outcome driven will find themselves scooting right past all the tiny little moments of discomfort in their day.
Yeah.
And so they won't notice until it's really built up to a point where they're behaving in a way that's really not okay anymore,
Yeah.
that there has been a building of it. And so the self-compassion break starts off with recognizing a moment of suffering.
Yeah.
Now, most people go, suffering, oh yes, death, that's a suffering.
Mm-hmm.
Or loss of something big, or, redundancy or a relationship breakup, that's suffering, real
Yeah.
suffering. To one of my clients, I said, so when you get the pub and they give you the wrong pint, that's suffering because it's not what you were asking for.
Mm-hmm.
When you've stubbed your toe, that's suffering. It's really important to recognize that and give yourself a moment to go, oh yeah, ooh, that was nice. And then the second part is suffering is part of life. Everyone experiences suffering. It is not to minimize your own suffering, because that's where people often go next, going, yeah, all right, other people suffer much more than me, so I'm not allowed to suffer.
Yeah.
It's recognizing that thousands of other people suffer in exactly the same way as you are suffering right now,
Mm-hmm.
to make it universal. It's not about you personally. It's not you being somehow at fault, and that's why you're suffering. Suffering is part of life. So recognizing that universality of it. So first step is recognizing the suffering. Second step is recognizing the universality of suffering in life.
Yeah.
So I said to one of my clients who's a gardener, do you have weeds in your garden because you're a rubbish gardener, or because you have a garden?
Yeah. Yeah. Yeah.
It's suffering is part of life. So if you're going to be alive, you're going to suffer.
Yeah, it's part of it. Yeah.
And the third part is then recognizing and then going, how can I give myself kindness in this
Mm-hmm.
moment?
Yeah.
Whether that be kind touch, or I don't know, stop for a cup of tea,
Mm-hmm. Mm-hmm.
or cuddle up in a blanket. Blanket burrito is one of the best ways of dealing with suffering.
Yeah. Yeah.
Finding your own way of
Yeah.
how to comfort that suffering.
Yeah.
And it's recognizing, when am I giving myself kindness and when am I actually avoiding my suffering? Because if you've done the first two steps, then the kindness is in the right place because you've done the first two steps.
Yeah. And I was going to say something very powerful as well, because it's about recognizing people's needs, isn't it? It's about acknowledging, it's not minimizing what people are experiencing.
Yeah.
It's actually fully allowing them to experience what they're experiencing, and not sort of, like you say, just ignoring it, like so many of us ignore these small annoyances or whatever. And that can often lead to that, like you say, the behaviour being that sort of explosion, maybe, where you've had lots of little things happen during the day, and then that might lead to you exploding at the end.
Yeah.
And then you really have something to regret after
Then you
that.
have a big deal, yeah. And do you know what's really important about mindfulness in this context is that in our society, people really only want to see the positive, right? They don't, people feel like they're a burden when they've got difficulties going on, because our society rewards you if you're telling people you're doing well.
Yeah.
And so it makes people much less likely to share their difficulties with other folk. And especially if you're a minority, if you happen to be an ADHD-er, and the DSM-5 reckons we're around about 5 to 10%, depending on which country you're in, of the population, then other people, there's a lot of other people who won't have the same experience as you. So you're likely to hold on to that instead of allowing yourself to feel it and go, yeah, that is hard.
Yeah. Yeah. And this must be one of the sort of powerful things about neurodivergent clients working with neurodivergent therapists. I don't know how much you use self-disclosure, but that might be quite useful to people.
I'll put it everywhere. I want people to know that when they come and speak to me, I'm not going to shame them for the floor drobe that they invariably have.
Yeah.
For the inability to do the dishes when they're supposed to do them.
Yeah.
And for having the emotional meltdowns that they've had, right? Because an awful lot of other people would go, well, do you think that's appropriate in a situation where you've exited your window of tolerance? Whereas for ADHDers, yeah, it is, because actually you can't see all the load I've been carrying until I've got to that point.
Yeah.
And yeah, maybe I want to find a way of approaching that, or
Yeah.
maybe addressing it earlier on in the growth.
Mm-hmm.
But yeah, being able to say to someone, those moments when my emotions just take me and go,
Yeah.
and I can go, yeah, I do.
Yeah. Yeah. And here, I'm just going to pop this in because this sort of goes
Mhm.
back to what we were talking about from Danielle.
Yeah.
With being a therapist, doing paperwork is hell.
Oh,
Yeah.
yes.
And
So
people don't understand that, do they? And people can say things like, well, keeping your notes is quite easy, or doing
do
your
a
admin
bit
is,
at a time.
yeah, and I
Get
mean,
a
you just
bullet,
sort of,
get a bullet diary. You'll be so much better.
oh God, I've never understood how those things work. Or even
Not for me.
why would people want to use them? But anyway, yeah,
There are people who want. There
yeah,
thousands
yeah,
of people buy them.
yeah. But
Yeah.
this is part of it, isn't it? That it is
Mhm.
actually really difficult. Some of the things that other people think is just easy,
Yeah.
for ADHD people, it's always been difficult, and it continues to be difficult. And there's a load of all those years of it being difficult sort of piled up, and it just
Yeah.
makes it really hard to do this sort of
Yeah,
stuff.
Danielle, this story about being certain that your daughter is an ADHD-er, but having to go through the assessment form is so well known to so many people.
Mm-hmm.
And it's emotional because you're working through your own stuff as you're filling in the details of your child, especially if sorry, I'm assuming you're an ADHD, no, but no, that's not what it says there. It says your daughter is 90% ADHD.
Yeah.
So, but in my case, when we were doing the assessment forms for our child, my husband and I were sitting there going, but that's normal. But that's normal.
Yeah. Yeah. No,
Took
I
a
can
long time
identify
for
with
that
that.
penny to drop.
Yeah. I had to do an assessment for my son, who's
Uh-huh.
grown up now, so we had to go back to his his school reports, and it was really quite difficult. But the thing that made us all sort of smile rather ruefully to ourselves was my daughter-in-law, who's probably not ADHD, but is probably autistic. She said,
Yeah.
can't you tell that you're an ADHD family? She said, because we've been waiting for you to do this form for about 6 months, we just kept putting off doing it, and
Yeah.
just sort of going back and like you say, because I mean, they ask you these questions like, did he forget to take a lot of stuff to school? And I thought, no, they never forgot to take anything for school, because I adapted and I would pack their school bags. I knew exactly what they were doing at school and what
Yeah.
days they needed to take their PE kit in and what
Yeah.
they needed in their bags, because otherwise our life would have been hell. So I just did everything for them.
Exactly. Yeah.
And then later
So
on in life, I sort of, I thought, oh, isn't it terrible how I've done all this stuff for my kids? But now I realise why.
yeah,
Oh, yeah, it
you
makes sense.
you were a coping mechanism for them.
Yeah, yeah,
Yeah. And Danielle, honestly, if you're needing help with that stuff, there are many, many ADHD parents who would love to sit with you and do a bit of body doubling,
yeah,
and not judge you for
yeah,
how it's going, because it's hard. I really feel
yeah.
for you on that one.
And Laura said the same. This was my biggest challenge with the form. It was so hard, as his behaviour is normal to me. We've adapted life around his ADHD, and I think that
Yeah.
as parents, that's what we tend to do, isn't it? We just adapt. This is normal.
Mm-hmm.
And I saw a comment on a parenting site recently where you read it and you think it was obvious, pretty obvious, that this child is very likely to have ADHD, and the parents sort of, well, is it a possibility? And everyone else is saying, yes, it
Uh-huh.
definitely is. But you just see it as normal, don't you?
Yeah, and
Yeah,
especially if you've only got one child, then
yeah.
and you're older parents as we are, then what context have you got? You're not spending your day with children, so you can't compare one to the other. You certainly don't have more than one of your own. So this is just how they are. This is how they came out.
Yeah, yeah. So this is normal. This is your
Yeah,
normal, isn't it? Yeah.
exactly. Yeah.
So just coming back to the course, actually, I just want to pop another question in that someone's
Mm.
put from Helen. Is
hmm
this course suitable for counselling practitioners to use to work with clients?
So it's not aimed at counselling professionals as a CPD course,
Mm-hmm.
but counsellors can definitely benefit from this, because what they'll do is they'll be able to learn the practices for themselves. So short practices like 3-minute breathing space or self-compassion break are little things that you can learn for yourself and adapt to whatever you're using in therapy. Depending on the modality of your therapy and how long you're likely to see your clients for, perhaps if they agree, yes, you can do little practices as part of your sessions, but it depends on how receptive they are to that. If you shoehorn it in, it may be that people will go, do you know what, I'm done here. It's really important to get that buy-in before you start doing it. It is a way for people to learn mindfulness that is more effective than trying to do it on their own if they're doing it with their therapist, because there's someone with them. If they're trying to do it with just an app on their own, especially if they're neurodivergent, there's a high chance they're going to lose interest in that app. And it'll be just one more subscription that you're paying every month, and you've never paid attention to the fact you're still paying it and never using it.
Sorry.
So yes, still fighting with some organizations this week, and because I can't find my password for getting into the account, I can't talk to them about it anyway.
Yeah.
So your question is, counseling professionals using mindfulness for their clients? Yes, there are small practices that you can incorporate in your sessions. If you know how mindfulness works, you can help your clients to go through it in a sequence themselves. But there's some good learning to be done to become a mindfulness tutor, to know about the risks associated with all the practices. Being trauma informed in mindfulness is super important. For example, if you're doing a body scan with someone who has difficulty with a particular part of their body, they may not be able to continue with that practice unless you have made the right preparation for that. If you've given them the tools to be able to choose when they get to that bit what they do, it might put them back a bit. So it's really important that if you're going to be using mindfulness practices, that you totally understand the rationale around them. So yes, if you've come to my course, that's not teaching you how to be a mindfulness professional, but it is giving you some insights, some small bits that you can take with you. I guess the thing to say about this is that it's not necessarily something you're going to use directly with your client. There are small parts that you can, but what mindfulness gives you as a practitioner is the ability to sit with your own experience and to make the focus on the client, which, if you remember your training, that AGE, Rogerian acceptance, genuineness, and empathy, lives in being present with what's going on. So it enhances your ability to regulate your own emotions. It enhances your ability to notice what's going on in your own experience, in your thoughts and your emotions while your client's speaking to you, because
That's
it's all
interesting.
happening at the same time, right?
Yeah.
Because sometimes people go, I'm just with my client, that's all I'm doing. And actually what that means is you're not recognizing what's going on in your own experience, which means you may be surprised when you go, oh, I'm really feeling quite stressed about this. And you hadn't noticed it until it was interfering with the interaction with your client.
Yeah. It's an interesting thing to think about, actually, isn't it? It's as a neurodivergent practitioner yourself. You did allude to this just before we came on, actually, about, because I said, what's it like being a neurodivergent practitioner working with neurodivergent clients?
Yeah,
Can you remember what you said?
I said it's sometimes more tangent than topic, and that's okay. We need that. We need to be able to make the tangents, because actually what we're going to do is we're probably going to make those connections a lot easier if we're allowed to work our brains the way they work.
Yeah.
If I ask my client a question in order to get them to process something, and I don't let them go from Picasso to pianos, then what I've done is I've curtailed their ability to think in the way that they think. And so it's important for me to be able to sit with that. And here's the thing about ADHD is it's very hard to be patient sometimes, right? Waiting for stuff, nah. So when I'm sitting there and my client's going from Picasso to pianos, and I'm thinking, I asked you what color it was, that's when I'm able to feel my own discomfort and go, oh yeah, that's that ADHD discomfort with being patient that you're experiencing right now. Sit with it. Sit with that discomfort. Allow it to be there, because it's valid.
Yeah. So this is actually using mindfulness in yourself.
Yes.
To
So
help you with your
experiencing my
client work.
own inner work while I'm being there for the client.
Yeah. And like you say, I think especially what you said earlier about, I can never say the word introception, the fact that we're not necessarily that good at noticing what's going on in ourselves, and mindfulness obviously helps to increase that ability within us, those of us that are practitioners who are ADHD as well.
And
it
it's going to
can
help
give
your
us,
self-care, because you're going to
yeah.
remember to go to the loo at the end of that session before the next one starts, if you've noticed, because you've sat still with yourself.
I know, that is definitely a problem, isn't it?
Yeah.
So I'm just having a look to see if there's anything else I wanted to ask you. Is there anything else you wanted to talk about, Liezl, that we haven't covered?
Let me have a little look through my list. I think the most important thing is to say that for therapists, if you were to come to my mindfulness course, it's for you, but it will pay benefits to your clients, because what you do to deal with your own emotional regulation, what you do with your own decision making, passes on to your clients. And the other thing to say is, on Fridays, excuse me, I've been meeting therapists, particularly ADHD-ers who are therapists and work with ADHD-ers. I've been meeting them online on Zoom to do some networking. There you go, thank you. So that we can have more of a community, because it can be very isolating working, especially as I do online exclusively. Unless I'm in supervision or group supervision, I don't really get to speak to other neurodivergent therapists unless I make an effort for it. And the things I've learned and the things other people have gained from this cross-pollination on a Friday for half an hour or an hour has been really, really helpful. So be really great if any of you wanted to spend half an hour or an hour with me on a Friday. And then in October, I'm going to get all those people together again in a group so that we can all do that cross-pollination quicker.
Oh, lovely.
In
So
one
sort of
place.
get to meet each other, and yeah, brilliant. That's really helpful. I mean, I was just talking to someone this morning and sort of saying, do you know any other neurodivergent therapists, and just how important, useful that is, and also for cross referrals as well. If you're in private practice, to be able to refer people on who perhaps you can't work with, and receive referrals in return as well. So, and we've got some other comments which I think, unfortunately, I don't think we're going to be able to have time to sort of cover, which will be on the Facebook feed. So you could maybe sort of take a have a look.
Yeah, I'll respond to that.
Yeah. So Victoria said, how do we sign up for that? So I think the best thing to do is to sort of email Liezl via her connect@rewiretherapy.co.uk.
Yeah.
Just a final little reminder.
And my virtual assistant, paid for by Access to Work, will help me keep an eye on those emails.
Yeah. And just a reminder about Liezl's course that's starting on the 19th of September. I mean, I found that mindfulness, the reason I did a mindfulness course was my friend was going to do it. And I thought, well, I can't let my friend know more about it than me. So I went on it for that reason. But also, I'd been meaning to learn more about it, but I needed that accountability. And that was the thing that going on a course absolutely gave me. Was I did pay for it. So, I wanted to make the most of it. But B, because we were meeting week by week, it meant I'd go along to the class because I booked it and I paid for it.
Yeah.
But also it made me do the practice in between, which I think with the apps, you can give yourself a bit of a free pass, can't you? And you can say, like you say, you just don't bother to open it, go on paying for it, which makes you feel better, but you're not actually doing it. Whereas if you've got a course that's got a start date and an end date, it actually makes you attend. And I think particularly for ADHD people, that can be a really useful thing, can't it? That accountability.
Oh, it's useful in so many different ways.
Yeah.
Mindfulness courses work best if they're taught in groups, but we have to recognize that that's not possible for everyone, right? Some people have really good reasons for not wanting to be in a group to do this.
Yeah.
However, for the majority, doing it in a group is best, because you're growing that sense of universal suffering. Because we do a bit of feedback into sessions about people's experiences in their practice. And if you hear 5 other people saying, yeah, I felt that too, it feels a whole lot less isolating.
Yeah.
There's the accountability. We're all going to be here for 90 minutes. My sessions are 90 minutes. Most other mindfulness courses are around about 2 hours. But, come on, ADHD-ers, we can't sit still that long. And so coming into the course means you're going to be with other ADHD-ers with similar experiences to your own. It means you're going to be able to discuss any difficulties you've had in practicing during the week, if you've been practicing. You're going to be able to learn some tips from other people, because sometimes folk come up with some ingenious ways of making sure that they can do it for themselves, and maybe your way is going to be helping someone else to do it. And the cost is definitely a relevant thing, because you said, I've paid for it, so I'm going to do it.
Yeah. Yeah.
And the cost is relevant because, yes, if you've paid for it, you're much more likely to stick to it. But because this is a beta course, I'm going to be asking participants to give me feedback on their experience so that I can learn and incorporate that in the next course I'm going to run. Now, most usually mindfulness courses run around £300 per course.
Yeah.
But because it's a beta course, I'm reducing it to £50 so that people have paid something,
Yeah.
but it's a whole lot more accessible. And because I'm asking them to give me something back, I can't exactly go and charge them the full rate.
Yeah.
So you'll be saving an awful lot of money if you come on this one instead of future ones. And you'll be helping other people who are ADHD-ers in future courses too.
Brilliant. Well, thank you, Liezl. Thanks so much for coming and telling us all about it. I mean, so Liezl, thanks so much for coming and telling us all about it. Thanks everybody for joining us as well. We've got a few more comments there, but people are just saying thank you both. Very interesting and thought-provoking, very insightful, and giving me lots to reflect on. And thank you both. Very interesting. So thanks so much, Liezl, for coming along.
Thank you all for being here. And thank you for having me on. Anytime I can help out with anything in the group, let me know.
Thank you.